Hello, my name is Lauren Harnois, and I am from Rush University Medical Center in Chicago, Illinois. Our study is titled Assessments of Fugitive Aerosol Particle Concentrations Generated by Small Volume Nebulizer and Vibrating Mesh Nebulizer, a randomized crossover trial in healthy volunteers. Here we have listed our disclosures. Nebulization has been described as an aerosol generating procedure which may place healthcare workers at an increased risk of contracting viruses such as COVID-19. Previous in vitro studies were done. However, we found no in vivo data available on the fugitive aerosol particle concentrations using different nebulizers with common interfaces or mitigation devices. Thus, we aim to explore the most effective method to reduce fugitive aerosol concentrations during nebulization. Here to the left is a photo of our study setup. This study was performed in an ICU room where two particle counters were placed at 1 and 3 feet from participants to continuously monitor aerosol particle concentrations of 0.3 to 10 micrometers in size. One investigator remained in the room while wearing an N95 mask. The participant wore an N95 mask before and in between the use of different devices and interfaces. Here we have pictured the mitigation devices used. 9 healthy volunteers were given 3 mL of saline using a small volume nebulizer and vibrating mesh nebulizer with a mouthpiece with filter shown here, a mask, and a mask with an Exhalo scavenger pictured here. We also did an additional study using the Vapotherm scavenger shown here and a filter face mask pictured here. These figures compare vibrating mesh versus small volume nebulizer with a mouthpiece and face mask at 1 foot from participants. Small volume nebulizer had higher fugitive aerosol concentrations than vibrating mesh nebulizer. Masks had a higher fugitive aerosol concentration than a mouthpiece for vibrating mesh nebulizer, while no significant differences were seen for small volume nebulizer. These figures compare a mouthpiece with and without an exhalation filter and use of a face mask with and without the use of an Exhalo scavenger at 1 foot from participants. Fugitive aerosol concentrations were lower with a mouthpiece and filter than mouthpiece alone for both small volume and vibrating mesh nebulizer. Placing a scavenger on an aerosol face mask reduced fugitive aerosol concentrations for the small volume nebulizer, but no significant differences were seen for vibrating mesh nebulizer. These figures illustrate comparisons of the Vapotherm scavenger and filter face mask. Compared to an aerosol face mask alone, the filter mask reduced fugitive aerosol concentrations for small volume and vibrating mesh nebulizer. The Vapotherm scavenger also reduced fugitive aerosol concentrations for both small volume and vibrating mesh nebulizer. Some limitations to our study were only 5 participants volunteered to continue the additional test with the filter face mask and Vapotherm scavenger. Future studies with larger sample sizes are needed to confirm our findings. We also used healthy volunteers who may have different breathing patterns than actual patients. All of our measurements were made in one ICU room at our hospital, and results may vary in different hospitals depending on environmental factors. And finally, our study did not investigate the virus load. Our findings can be meaningful to help clinicians avoid secondhand inhalation of medical aerosols during nebulization. A vibrating mesh nebulizer may be preferred over a small volume nebulizer for patients with COVID-19 due to the risk of contamination with a small volume nebulizer. If a small volume nebulizer is the only choice, then adding a filter to the mouthpiece is recommended if patients can form a tight seal and breathe through their mouth. If a mask must be used, a filter mask or adding a face tent scavenger with the aerosol mask is recommended. Finally, clinicians should stand at a minimum of 3 feet from patients as fugitive aerosol concentrations decrease with increasing distance from the source. In conclusion, small volume nebulizer produced higher fugitive aerosol concentrations than vibrating mesh nebulizer. Masks generated higher fugitive aerosol concentrations than mouthpiece. And adding a filter to a mouthpiece or scavenger to a mask reduced fugitive aerosol concentrations for both small volume and vibrating mesh nebulizer. We also found the Vapotherm scavenger and filter mask had similar effectiveness in reducing fugitive aerosol concentrations as a mouthpiece and filter. Thank you, and I look forward to answering any of your questions.